Nipple confusion is a common issue that many new moms face when trying to breastfeed their babies. It occurs when a baby has difficulty switching between breastfeeding and bottle feeding, leading to frustration for both the baby and the mom. However, there are several tips and strategies that can help combat nipple confusion and make the breastfeeding experience more successful. One of the most important things to remember when trying to prevent nipple confusion is to wait until breastfeeding is well established before introducing a bottle. This typically takes about 3 to 4 weeks, as it allows the baby to become familiar with the breastfeeding process and establish a good latch. Introducing a bottle too soon can confuse the baby and make it more difficult for them to latch onto the breast properly. When it does come time to introduce a bottle, it's important to choose the right type of nipple. Look for a bottle nipple that closely mimics the shape and feel of the breast, as this can help prevent nipple confusion. Additionally, make sure to choose a slow flow nipple to prevent the baby from getting used to a faster flow than they would get from breastfeeding. Another tip for combating nipple confusion is to use paced bottle feeding. This involves holding the bottle horizontally and allowing the baby to suck and swallow at their own pace, rather than tipping the bottle up and allowing the milk to flow freely. This can help mimic the natural flow of breastfeeding and prevent the baby from developing a preference for the bottle. It's also important to be consistent with feeding methods. If you are breastfeeding, try to avoid using a bottle too frequently, as this can make it more difficult for the baby to switch between breastfeeding and bottle feeding. Similarly, if you are bottle feeding, try to stick to a consistent feeding schedule to help the baby establish a routine. If you are struggling with nipple confusion, don't be afraid to seek help from a lactation consultant or other breastfeeding support professional. They can provide guidance and support to help you and your baby overcome nipple confusion and establish a successful breastfeeding relationship. In addition to these tips, there are also some common mistakes that can contribute to nipple confusion. One of the most common mistakes is using a bottle nipple that is too fast flowing, as this can make it difficult for the baby to switch back to breastfeeding. Additionally, using a bottle nipple that is too different from the breast can also contribute to nipple confusion. It's also important to pay attention to your baby's feeding cues and respond to them promptly. This can help prevent frustration and make the feeding experience more enjoyable for both you and your baby. Some common feeding cues to look out for include rooting, sucking on their hands, and making sucking noises. Finally, remember that every baby is different, and what works for one baby may not work for another. Don't be afraid to try different strategies and techniques to find what works best for you and your baby. With patience and persistence, you can overcome nipple confusion and establish a successful breastfeeding relationship with your baby.